Okay, we're going to be doing the lumbar spine imaging, positioning, and first I'm going to start out with the AP lumbar spine. I have a 14 by 17 image receptor, or the 35 by 43. I have my right marker to the right edge of the cassette, which is marking the right side of the body. Now for the AP lumbar spine, you palpate for the iliac crest, and we're going to go 1.5 inches above the iliac crest. So we would use, you can use the 3-finger method, which 3 fingers typically is 1.5 inches, could be up to 2 inches depending on the size of the fingers. But we'll go 1.5 inches above the crest, so you'll palpate the crest. Your transverse line is going to cut right across the very top of your finger of that first digit, and then it will be centered mid-sagittal. Now, depending on the protocol of the department, you can have it, the collimation wide open if the radiologist is wanting to see the entire abdomen along with the spine, or you can collimate on the sides if the protocol is just to get the spine of the lumbar spine. Next, we'll do the RPO, the right oblique for the lumbar spine, the AP oblique. And the patient will be 45 degrees turn. Scoot your bottom hip towards me just a little bit. Okay. You always want to check and make sure that the body is good and straight and at the same angled plane, because we want it to be at 45 degrees. Make sure this elbow is up out of the way. Again, palpate for the crest. We're going to go 1.5 inches above the crest. So our transverse line will be cutting across the very top portion of our first digit when we're doing the 3-finger method. So we're going 1.5 inches above, and then you palpate the ASIS, and then we're going to go about 2 inches in front of the ASIS. So our longitudinal line will be cutting across 2 inches in front of the ASIS. You can collimate a little bit on the edges here. Okay, and that will be our RPO. Be sure your marker is going to be to the right side of the patient's body, so you will have the marker on this right edge of the image receptor. Alright, now when we do the LPO for the left AP oblique, we're going to have the patient turn 45 degrees again. And again, you want to check and make sure the angle, patient angle, is even from the shoulders all the way to the hips. Now David's hips are a little bit too high, so I'm going to bring it back because I want this to be at the same plane, and we're going to have it at 45 degrees. So again, palpate the crest. We're going to go 1.5 inches above the crest. And that's where our transverse line is going to be cutting across. Then you palpate the ASIS and go 2 inches in front of that. Okay, now since this is our LPO, we're going to use our left marker. And place your left marker to the left side of the cassette. Okay, and for those of you that are using the DR, you can place the left marker to the left edge of the patient's body. Okay, now for the lateral lumbar, roll the patient all the way up on their side and make sure that the back is nice and straight. You want the back going perpendicular into the tabletop. I'm going to straighten up David's back here because he was leaned forward just a little bit. So you want it to be nice and straight. Palpate the iliac crest. You're going to go 1.5 inches above the crest. And then you're going to be centered mid-coronal. Now you can come, depending on the patient's size, sometimes you will need to come a little bit posterior to that mid-coronal line. Okay, now because we are using the bigger image receptor, the 14 by 17, you can see all of this extra light. You can collimate in, and we can also use some lead to place right behind him like this. That way the scatter is going to be absorbed, and we're not going to have all this extra scatter hitting the image receptor. So this is our left lateral lumbar. And then for our L5S1 spot, I'm going to angle caudally about 5 degrees. Now, I will make a comment when I look at David's back, because his spine is nice and horizontal. On him, we could probably go ahead and not use an angle, but for those patients that do have a curve in their back and the back is not horizontally going horizontal with the tabletop, you would use a 5-degree angle on men and then up to 8-degree angle caudally for women. On David, I think we'll be fine using the vertical central ray. Then we'll palpate the iliac crest and go 1.5 inches below the iliac crest. Now, since we are only interested in the L5S1, we no longer need the large image receptor, so we can change this out. And I'm going to use the 24 by 30 centimeter image receptor. His left side is touching, so I'm placing my left marker on the image receptor, and then you can collimate in, because we do not need that entire field size unless your radiologist likes to see the entire sacrum. Then you can keep the entire length of this. But on David, because again we're checking this horizontally spine, that means that the iliacs are directly, the inner iliac line is perpendicular to the table. That's why we can get by with the vertical central ray. If we were going to use the 5-degree caudal, just angle it 5 degrees down, and be sure and center your bucket tray up. Palpate the crest and go 1.5 inches below that. Okay, and then we can collimate down like that. Okay, that's all for the lumbar spine.